Good afternoon. Thank you so much for joining us this afternoon for our second annual pink lighting of the Islip Town Hall cupola in recognition of October as Breast Cancer Awareness Month. And it's really amazing. You know, we did this last year for the first time, and we had a nice turnout. I don't think the weather was quite as nice as it is today. It might not have been as windy, but it's so nice to see that this has grown. And you're going to be hearing from some speakers in a moment that really we're going to be taking this to the next level. Before we get to the formal program and the speakers, I would just like to recognize some of the people who have taken the time to join us today. And I think it speaks volumes to the fact that the support for what we're trying to do here to raise awareness is so broad-based, and it starts with someone who has been so supportive of these issues, and that is New York State Senator Phil Boyle. Phil. Also, we have representatives from Senator Monica Martinez's office. Both Lindsay and Christina are here representing Senator Martinez. And from the office of the New York State Attorney General, I've met her a number of times over the past year or so, Letitia James, and that's TJ Hatter. And from our town of Islip, I'd like to begin by recognizing Councilwoman Mary Kate Mullen, Councilman John Cochran, the Receiver of Taxes, Alexis Wyke, our town clerk, Olga Murray, from the Islip Breast Cancer Coalition, Gina Cacaperto, from Good Samaritan Hospital, the Chief Operating Officer, John McMurray, also from Good Sam, Justin Jason, and we have many, many representatives from the various chambers of commerce across the town of Islip, from the West Islip Breast Cancer Coalition, and also these lovely ladies in pink from the Guilds of Good Samaritan Hospital. This year's theme, Pink by the Bay, was launched by Northwell Health and is designed to raise awareness of breast cancer prevention, detection, and education along the Great South Bay. With merchants, businesses, and the community from Babylon Town Hall through East Islip taking part, Main Street will be illuminated in pink lights for the entire month of October. Early detection is the best prevention. West Islip, right here in our town of Islip, was the birthplace of the first ever breast cancer mapping project. In early '92, West Islip resident Lorraine Pace was diagnosed with breast cancer, and she soon learned that 20 people she knew of, all who lived near her in West Islip, also had breast cancer. That spurred her very public, relentless crusade to call attention to breast cancer in Suffolk County. Along with her husband, John Pace, Lorraine founded the West Islip Breast Cancer Coalition for Long Island. Lorraine was worried that chemicals in the ground were getting into our groundwater. With the help and support of medical professionals and the encouragement of Good Samaritan Hospital, Lorraine began to survey the women in her neighborhood about breast cancer and put their responses on a map. You know, I was there. Lorraine first came to me. I was the chamber president, and she wanted the chamber to endorse or sort of reinforce her efforts. And I said, I think you need more than the chamber, maybe the hospital. And she went down to Good Sam, and they jumped on board. And after 18 months, she and her cadre of volunteers had covered over 8,700 homes in her zip code. They also involved the Suffolk County Water Authority. At the time, he has since passed away. Michael Grandy was the chairman, and he too became very much involved in helping her in her initiative. And also a publication known as Suffolk Life, who is no longer around, but they actually took the survey, printed it on the front page of their newspaper. It was a weekly that was mailed to every home. They published it for free for a number of weeks, really helping in her initiative. And this really was the beginning of the breast cancer environmental movement, and it began right here in the town of Islip. Last year, I was approached by Gina Cacaperto of the Islip Coalition, who asked about lighting our Christmas tree pink in recognition of breast cancer awareness. And it reminded me of the time at the legislature when we lit the Dennison building, and I thought, why not Islip Town Hall? So here we are today. I'd like to now invite Eddie Fraser, who's the Vice President of Community Relations with Northwell Southside Hospital, to say a few words. And Ed's been a good partner in so many initiatives here in the town. Ed?
So last year when we did this with Angie for the first time, of course you walk away saying, how can we make this bigger and better and partner together? So a couple of weeks later we talked and said, how do we turn this whole South Shore pink? So we had a couple of meetings and we said, we need to come up with a name and let's get this done. So I had a really great vision with my team, and at this time I want to say thank you to the team that's behind me. This has been a 9-month project that has been taken a total labor of love, going to every store in town from East Islip to Babylon. We have had over 300 stores that are participating, and we still have more coming in just today to light up their stores. So with that said, thank you to my team. They're all behind me. Raise your hands, guys. Neither recognition.
And it truly is about partnerships, and there's no better partner. Next, I'd like to bring up Valerie Berger, who heads up cancer services at Northwell.
It's my honor and my pleasure to be here. I've been an oncology nurse for about 28 years now, and the things that I've seen pale in comparison to what this town and this community has come together to do. Eddie's team, he understates just how much of an effort this was to go store to store, day after day, and really get everybody to come together. And what you guys have done is you've brought that volunteerism to a new level. Because you volunteered to be here. Nobody said you had to be. Nobody said this is good for you. You're here because your hearts led you to be here. You're here because you want to support, you want to bring awareness, and you want to share some of the gifts that you have with those who are fighting a fight, sometimes for their lives. This is the time of year when everybody turns towards breast cancer and thinks pink. But we are now going pink in a really, really big way. This year alone, an estimated 17,490 women and men will be diagnosed with breast cancer. This year in New York, 2,400 women will die of breast cancer. We're here to bring awareness to that. We're here to offer our support to help early detection become a norm and not something that happens too late. Here, we're very fortunate. You have your choice of imaging places to go to. We have a beautiful one right behind us here. And in this month of October, they do a lot of special things to bring women in to do that. And it's important that we provide those opportunities and we give that sense of normalcy, not fear, to mammography and to cancer screening. So if you know a woman, encourage her to get her mammography. If you love a woman, go with her to get her mammography if she's afraid to go on her own. But get it done, get screened, bring awareness, and don't be afraid to talk about it. We're lighting the town pink because light is what darkness most fears. So we want to light it up, we're going to light it up pink, and we're going to do it right.
Now I'd like to introduce someone who is really spearheads so many efforts in our community. She is the executive director of Northwell Southside Hospital, a good friend, Donna Moravik.
Hi, everyone. So I have a confession. Not only am I a nurse, but I'm a nurse practitioner. And when I came to Southside Hospital 7 years ago, I realized nothing's impossible. I look across at that beautiful imaging center and the cooperation between imaging, collaboration with the InBirth Center and breast cancer patients. It is just remarkable what has been accomplished in this community in the past. I've been here 7 years, in the good 10 years. My mom had I'm an open heart NP, sorry. My mom had her breast cancer about 15 years ago, and she went to North Shore University Hospital in Manhasset. And what I'm proud to say is the community care and having your breast surgery or your diagnosis done in your local community is an unbelievable option.
Before we go on to the next speaker from Good Samaritan Hospital, I was a little negligent. I spoke earlier about the fact that this is a joint effort with the town of Babylon, with Supervisor Rich Schaefer. Saw him earlier this morning, and he is not able to be here today, but he did ask Councilwoman Jackie Gordon to be here on his behalf. Jackie, if you would say a few words.
Just to reemphasize how important these recognitions that we have, where we have months or days that we pay attention to certain things that happen. And we wonder, well, does it really make an effect? Does it have an effect? It does. It really does. We're really working hard, all of us, on the entire South Shore on Long Island in New York State to make sure that this cancer, this is one of the most preventable cancers, and the easiest way to prevent it is to get checked, is to get your mammogram. So, on behalf of Richard Schaefer and the entire town board, I am so honored to be here in partnership with the town of Islip and the Islip Town Board so that we can light up this town hall, and simultaneously the town of Babylon Town Hall will be lit at the same time, and our lights will be pink for the entire month as well. And we will continue to encourage every woman and man, I have an uncle who had breast cancer, to get checked.
And more than one speaker has made note of the fact that breast cancer is not exclusive to women. Men do get breast cancer. And a gentleman who was on the forefront of educating people about that very fact was a former Suffolk County legislator, Cameron Alden. Cameron has had some health issues of late. He was here last year, and I just know that he's here in spirit. He so believed in the fact that you can beat this. Early detection is the key. So let's keep Cameron in our prayers as he struggles to get better. But let's do honor to him by making that appointment if we haven't done it already. So when we talk about making appointments, you're going to do it with a surgeon. And we are very lucky to have with us today from Good Samaritan Hospital a breast surgeon. And again, I've said it before, we are so fortunate in the town not only to have one hospital, but two world-class hospitals right in our own town of Islip. And from Good Samaritan Hospital, we have Dr. Sophia Fu.
I'm Dr. Sophia Fu. I'm the Director of Breast Surgery at Good Samaritan Hospital. As one of the first breast cancer clusters of its kind in the nation, the South Shore community and Good Samaritan worked hand in hand to develop the Good Samaritan Breast Health Center to provide resources and services for patients and families. Now celebrating the 25th anniversary, the Breast Health Center at Good Sam continues its commitment to women, men, and their healthcare needs. This is done through a dynamic, multidisciplinary approach to breast cancer care.
So, you've heard it time and time again. It's all about early detection. It's all about taking the initiative, getting that mammogram. There's really no excuse. There really is no excuse. So next year when you come here, I want to hear that everybody's already made their appointment, and not that they're going to be making it in the coming weeks, as Donna said, and I'm going to be doing too. I would just like to ask all to gather around, and we'll officially, if my town board members can join me, we will throw the switch. One.